If your leg hurts or your foot is numb or every step sends pain shooting down your back, you're not alone. Most people with a bulging disc, L4-L5 or L5-S1, are desperate for answers. But usually all they get is confusion, fear, or sometimes just plain bad advice. In this video, I'm going to answer the top 5 questions people ask me when they're dealing with a disc bulge or disc herniation. So you'll finally understand what's happening to your body and what to do about it. You're going to find out why your symptoms don't always make sense, what movements are secretly making it worse, and whether surgery is even necessary. At the end, I'm going to share one overlooked but powerful principle that can speed up healing, help prevent permanent nerve damage, and prevent back surgery. Make sure you watch all the way to get that final tip. I'm Dr. Gregory Kramer. I have over 30 years of clinical experience in advanced certifications in chiropractic biophysics. That is the premier corrective care technique on the planet. I specialize in treating neck pain, back pain, disc bulges, sciatica, knee pain, neuropathy, old whiplash injuries, and other degenerative spinal conditions using a variety of corrective care methods, spinal decompression, and targeted exercises. Before I continue with this video, I need you to hit that subscribe button if you want to learn how to eliminate pain, stabilize your spine, avoid spinal surgery so you can live stronger, longer. Before we dive into the first question, I want you to know this. If you're dealing with a disc bulge at L4-L5 or L5-S1, the pain you feel is real. I've been there. And the more you understand what actually is going on, the better decisions you can make and avoid long-term damage. So let's break down the top questions and the ones that are the most confusing, just like people like yourself are asking, starting with the one that confuses almost everyone. Why is my leg in pain if my back doesn't hurt? That's probably the number one question, the most confusing part. So you might expect back pain to be the main issue, but what many people don't realize is that when a disc bulges or herniates out of place, it can press directly on a nerve root, especially L4, L5, or S1, without causing any pain in the lower back itself. So you might have a little bit of pain in the low back, but the pain is so great that you ignore the back and feeling mostly the leg. Instead, that pressure, or what we call sciatica, affecting the sciatic nerve, is called a radiculopathy, all right, which basically means pain that radiates down your leg. You might feel it in your buttocks. If it gets worse, it'll travel further down to your thigh. If it gets worse, it goes into your calf. And obviously, if it gets even worse, or worser, is there such a word as worser? It'll go to your foot. Basically, the further the pain is from the center of your spine, the more detrimental, the worse it gets. So we like to call pain that gets closer to your spine centralization. So anytime the pain gets closer to the center of your back, that goes from a pancake size to a quarter, that's a sign of something good. If the pain peripheralizes, in other words, it goes further from your back, butt, thigh to foot, that means the worse the pain, the worse, the more damage to the disc is. And we want to avoid anything that peripheralizes the pain. We want to do things that centralize the pain. An MRI might show phrases like posterior lateral disc bulge, or nerve root impingement, or foraminal narrowing, where just are different ways of saying that the disc is putting pressure on the nerve as it exits the spine. So foraminal narrowing means the holes where the nerves come out, there's between two bones, there's a little canal, and that's what we call a neuroforaminal, and it's getting smaller. So something's taking up space. That's why you could have intense leg symptoms like burning, tingling, numbness, weakness, with no back pain at all. I've seen this exact scenario many times in our clinic, and we've helped hundreds of patients, probably thousands, with L4, L5, and L5-S1 disc issues. That means either a bulge or a herniation. Get real long-term relief without surgery using a combination of corrective chiropractic care and non-surgical spinal decompression. This approach takes pressure off the nerves and helps the spine to return to a healthier alignment so the body can start to heal itself. Now that you understand how leg pain can happen without back pain, let's look at the next big question almost everyone asks. Can a bulging disc heal on its own without surgery? Well, short answer is yes. Many people with a disc bulge or disc herniation worry that surgery might be their only option. That's understandable because the pain can be intense, can be debilitating, and it'll feel like it never improves. I myself had an active disc herniation 2 years ago, And I have some previous videos that show it, and I'm training today. I'm lifting weights. Now I'm cautious. I do martial arts, but I'm cautious. But yes, most people in my clinic, we have over a 95% success rate with herniated disc, avoiding not only disc surgery, but also shots or epidurals. So we can't help everyone prevent that, but we have a high success rate for the majority of people. So it's true that in some cases, surgery is absolutely required. And sometimes surgery can be life-saving, especially if there's signs of cauda equina syndrome, such as you're losing control of your bladder or bowel control. Now that's rare, but it's a medical emergency. In other situations, a person may have spinal instability, where the spine actually collapses, and that may also require surgical intervention. So again, our goal is to stabilize your spine. But there are some spines that are so unstable that can lead to surgery down the road. But if you do the right things, it's very rare. The majority of patients with disc bulges or herniations can avoid surgery. In some cases, a disc bulge can heal on its own with time. The body can gradually reabsorb some of the disc material and reduce inflammation around the nerve. Now, without professional help, this process can take a long time, and you risk the problem becoming chronic or even getting worse. That's always best to get a professional treatment early, a professional diagnosis. Most important thing, in addition to an MRI, you need a weight-bearing x-ray and a motion x-ray where you actually bend, where you actually stress the disc and see what is happening. Now, the best way to avoid surgery is early intervention. As soon as the back or leg pain appears, don't wait or assume it'll go away. You want to get immediate assessment, particularly by someone that has a biomechanical knowledge. Now, treatments like targeted chiropractic adjustments, corrective chiropractic care, spinal decompression, laser therapy have all helped hundreds of my patients recover fully without surgery. Even patients been dealing with chronic disc issues for months, sometimes years, have responded well to conservative treatment methods. And in some cases, people that have had multiple surgeries come in and we're able to help them. So, yes, in most cases, back surgery can be avoided. In many situations, it should be considered only as a last result. Coming up next, let's tackle one of the most searched questions online. What exercises should you avoid if you have a disc bulge or disc herniation? What exercises should I avoid with an L4-L5 or L5-S1 disc bulge or herniation? Getting your exercise program right is key. And we want to help your body heal, not interfere with it. But most people get this part wrong. They follow general advice from the internet, YouTube, social media that isn't specific to their condition, and that can make things worse. There are definitely some exercises that must be avoided at all costs, at least in the early stages of an L4-L5 disc bulge or disc herniation. Here are three of the most common and most dangerous ones. Now, let's start off with deadlifting. So if we're lifting something from the ground, we really want to keep a neutral spine, and I'll show you a complete video of it. But as a result, 3 months post-injury, we want to avoid our spine from flexing. That's from the side view where we bend forward. All right? We want to keep a neutral spine. We want to do something called a hip hinge where we bend at the hips. So we want to avoid compressive loading with flexion. So lifting from the floor, you want to avoid. So if your job is lifting sacks of flour from the floor, you need to make some changes. Now, forward bending movements. You want to avoid touching your toes, hamstring stretches. I know initially it might feel good, but I'm concerned not only what does it feel good for 15, 20 minutes, what about the next day, the next 2 days? We want to leave that disc alone. There are better ways to stretch your hamstrings, but you need to keep your spine straight. Again, down the road, I'll show you some exact details. You want to avoid crunching or sit-ups where you're flexing the spine. Flexion is not good for the disc, particularly in the acute stage. All right, so there are many other ways to strengthen your core, things like planks, things like Pallof press that I'll demonstrate on another day that are much safer, all right? And there are many other exercises you can do, things like the bird dog, certain types of extension exercises where you lean back, either lying on your stomach or standing up. Again, you got to be specific. I mean, for each person, one exercise can be a godsend, but it could be poison to the neck. So there's a little bit of pressure testing, a little bit of seeing how does your body respond. Does the pain centralize when you lean back, or does the pain peripheralizes and goes down your leg. That will guide you. Anything that centralizes the pain is probably a good thing to do. Anything that makes the pain go away from the back and further down your leg, not so good. So again, there'll be a video that I'll show down the road. Right now I just want to do big picture. Avoid flexion of the spine. That's where you're bending forward. Avoid a lot of compressive loading. You want to do a lot of walking and want to keep a neutral spine. And we'll talk about that more down the road. Now, the next question everybody asks me, in fact, I just had a patient today ask me, how long does it take to heal for a disc injury? And the answer is it depends. Usually anywhere from 3 to 24 months. Yes, 3 to 24 months. However, there's degrees of healing, like layers of an onion. So the first 3 months are critical that we allow proper healing. If you irritate the disc by flexion, now flexion means when we bend forward. So from a side view, you're bending forward. You can tear those little fibers in the disc. So we want to avoid bending forward. We want to be very cautious. Now the next video, I'm going to really go over safe ways to lift, and I'm going to go over in detail the exercises for you. But in general, when we bend, we want a hip hinge. Hip hinge means your spine stays straight, and you literally just bend at the hip. The spine stays straight. So understanding the disc will take anywhere from 3 to 24 months. You'll have degrees of healing. Usually within the first 3 months, about 80% of the healing, all right, occurs. But if you injure it, you kind of start over again. And so, number one, you have to understand, why does it take so long? Well, it's a serious problem. The disc is made out of cartilage. It's not highly vascular. They don't have a great blood supply like muscles do. Because of that, they heal slower, and that's why we're always trying to drive blood to the area with spinal decompression. And the way the body heals has to rely on passive fluid exchange. And how does that get achieved? It's through motion. So motion brings nutrients in, and we want to flush waste products out, which takes time and consistency. So gentle motion, walking in water, actually. If you're in a body like a pool or a lake that's safe, when you walk, you're pumping motion. And another factor is, how long has the pain been there? Are you the type of person that gets immediate appropriate care? Appropriate care is getting corrective biomechanical care, spinal decompression, corrective chiropractic where we're working on alignment. Those are core stability. Those are appropriate care. The sooner the better. So my experience shows that patients that start immediately do much better than someone that waits for months or years to recover. So if you wait 6 months, a year, or even longer before starting treatment, it can take much longer, because what happens is the body will heal with or without care. It's going to heal, but it'll heal wrong. Healing wrong means you're going to have more pain, more weakness, more stiffness. When you heal in the best possible manner, you want the least amount of pain, the greatest degree of range of motion, and the greatest degree of strength so it doesn't come back. So chronic cases, like I said, take over 6 months, sometimes a year, sometimes 2. Your age, your activity level, your posture, your lifestyle habits. Are you diabetic? Are you obese? Do you smoke? All those things affect blood flow. The more support you can give your body, the faster it recovers. And the right care. Again, I'm going back to spinal decompression. It tremendously helps accelerate the healing process, but by creating a pumping mechanism, relieving pressure on the disc, relieving pressure on the nerve, driving blood into that area, rehydrating the disc. Corrective chiropractic work to improve alignment, because when you're out of align, you're putting abnormal pressure on that disc. And anytime you have abnormal pressure, things start to wear out. Just like when the tires are misaligned, there's abnormal pressure, the tire wears out. So if you're dealing with an L4, L5 disc injury, don't wait. Get immediate attention. Get started with professional care. It's one of the most important things you can do to support a faster, more complete recovery. Now let's cover the question that causes the most fear. Now, one of the most frightening questions is my numb foot or my weak leg permanent, or will it heal? And that answer is, it depends. When do you start to lose the sensation? How long has it been there? How severe is it? The good news, in many cases, those nerve symptoms can improve. How much they improve, how quickly, depends on a few things. I had a gentleman today that came into me for my spinal decompression ad. He's an older gentleman in his 70s. He's fit, but he's had numb legs for years. and he's got a bad disc. Well, he's been under care for a couple weeks and his leg numbness is almost completely gone because we're doing all the things to improve alignment. We're putting decompression to pump and rehydrate the disc. So again, everyone heals differently, but some people amazingly fast and some people a little bit slower. And the good news is many times you can get rid of those nerve symptoms. Now, not always. If you've got a dropped foot for a couple years, I personally haven't seen that improve. However, if you've got weakness and you can get early, we can get after it early, get that pressure off the nerve so the body can regenerate, there's a good chance. The longer the pressure stays there, the more irritated and inflamed the nerve is, the more severe the symptoms can get and the longer it takes to heal. And just like discs take time to heal, nerves take time to heal. They don't have a direct blood supply, the healing is slower. And the longer a nerve that's been compressed, and the longer it can take to recover. That's why early treatment is so important. The goal is to remove pressure from the nerve as soon as possible. In our clinic, we use spinal decompression to relieve that pressure gently and consistently. I combine that with corrective chiropractic. Corrective chiropractic is we get a measurement on your spine. If you're out of alignment, we're trying to restore your spine to normal alignment using adjustments, exercises, and traction. Over time, we've seen patients regain sensation in their foot. They regain strength in their leg. And sometimes 100% completely reverse the symptoms, even after months of discomfort and weakness. Sometimes their problems only heal partially. It depends. How long has it been there? So no doctor can promise a full nerve recovery in every case. We've helped thousands of patients avoid permanent damage and get their full function back without surgery. So if you're experiencing a nerve symptom, don't wait. The sooner you take action, the better your chances of healing fully are going to be. Now, we've covered the 5 questions people ask about disc bulges, disc herniations. There's one last thing I want to share. A powerful recovery principle most people overlook, and fixing this could be the key to finally turning the corner in your healing. Let's talk about it. The one overlooked principle that can speed up your recovery. Most people focus only on pain relief. They try stretches, they try drugs, they try shots, rest, heat, medication, CBD, laser, all aimed at feeling better. And I understand that. I've been in your situation. But here's what they miss. The goal isn't just to feel better. The goal is to fix the cause of the problem. That means going beyond just pain relief and actually correcting what caused the disc to be weak in the first place. Generally, very few people are in perfect shape and then get run over by a truck or get run over by a buffalo. However, most people have had some weaknesses, then they do one thing that tears up that disc. So in most patients that I've seen with an L4-L5 or L5-L1 disc issue, the root problem often comes down to poor alignment, postural stress, mechanical imbalance that have built up over years. If all you do is chase pain relief, yes, many times you feel better temporarily, but the problem usually comes back. But if your focus is on restoring alignment, improving stability, taking pressure off the disc and nerves, that's where real lasting healing begins. And that's what we do with our patients. We use corrective chiropractic care to address the structure of the spine, spinal decompression to unload the disc and nerves. It's a 2-part approach that doesn't just reduce pain, it supports true recovery from the inside out. So if you've been trying to, quote, stretch it out or wait it out, but the symptoms keep coming back, it's probably time to change your approach, because your disc doesn't need temporary relief. It needs the right healing environment that starts with correcting the cause of the problem, not just covering it up. You now have the answers to the most important question about your disc bulge or herniation, and we've left you with a proven path to move forward. If you're looking for long-term relief, clarity, and real healing, don't wait. Get the right help, give your body a chance to fully recover. You now have the answers to the 5 most important questions people often ask me about L4, L5, or L5-S1 disc bulge. If you're dealing with this, don't give up. You're not broken. Your body can heal. It just needs the right support. Look for a corrective care chiropractor who understands disc injuries and can guide you through a real recovery plan. Do me a favor, like and share this video if I gave you hope or clarity. Comment below and tell me which questions help you the most. Subscribe if you want a real solution and expert insight for disc injuries, nerve pain, and long-term spinal health. Also, many people ask me, I'm located in Livonia, Michigan. However, if you're outside of Michigan, go to idealspine.com, okay, or CBP nonprofit where you can find research. You will find a doctor there that's trained in corrective care. And many of them also have spinal decompression. So you ideally would want a trained corrective care chiropractor that also does spinal decompression. I think that is the best 1-2 punch for dealing with any disc issue. And the next video you should watch is this one. It's L4-L5 disc bulge treatment using safe, non-surgical spinal decompression. Go watch now and see what we do in our office to help patients avoid surgery and start healing right away.